A very good day to you, and welcome to the HIV Interventions Program, proudly brought to you by the National AIDS Council. Compliments of the season to everyone. And of course, I hope you guys are doing safe and well wherever you are in the world. The HIV Interventions Program is a platform where we talk all things HIV, conversations around STIs, fighting against HIV and AIDS, and of course, looking towards creating an HIV free generation. And of course, today we want to start off on a high note by talking about World Cancer Day. So, World Cancer Day is just around the corner and it's marked on the 4th of February to raise awareness of cancer and, of course, to encourage its prevention, detection, and treatment. But you might be asking, Unique, this is an HIV interventions program. What does that have to do with cancer? Well, for your own information, HIV is linked with cancer. But of course, I'm not the expert here. I have with me Michelle Madzuzo, who is from Talk Cancer, to talk us through why there's such an intricate link between HIV and cancer. Welcome, Michelle. How are you today?
Thank you, Nick. I'm good.
Compliments of the new year?
Thank you.
Fantastic. So, Michelle, we're going to be talking about the World Cancer Day. Can you define what cancer is for us?
Okay. In the layman's language, cancer is a death sentence. But what I can say is, cancer is just a disease, just like any other disease that you know. So the human body has a way in which the cells divide. So when the cells divide in a way which is not organized, cancer results. That's why you see someone can end up having a lump, someone can end up having a wound, or someone can end up having an organ which is not functioning well.
Right.
That is now when we can say someone has cancer, and cancer is just a disease, just like HIV, and cancer is not a death sentence.
Cancer is not a death sentence. So let's talk a little bit about who is at risk of contracting cancer. I mean, obviously, we talked about the link between HIV and cancer. So can anyone get cancer, or is there a special group of people that can get cancer?
Okay, cancer is a disease which can affect anyone, whether you are young or old, whether you are black or white. Cancer is a disease that can affect anyone. And the risk of getting cancer now will depend on quite a number of factors. So we look at your lifestyle, your diet. If your diet is not as healthy, if you are eating too much salt, sugar, fat, then your risk of getting cancer is increased. We also look at genetics. There are some cancers which are linked to where you are coming from. Your genes also count when it comes to your risk of getting cancer. So there are certain cancers that can run in families, such as breast cancer, such as ovarian cancer, but it doesn't necessarily mean that if there hasn't been cancer in your family, you are not at risk. Everyone is at risk of cancer, but we are just saying at times the cancer risk is more if there is someone in your family who has a history of cancer. Then we also look at factors such as alcohol, drinking too much alcohol, excessive drinking of alcohol is linked to cancer, excessive drinking of alcohol. So we're not saying that if you have a glass of alcohol, then you're definitely going to get cancer. And what you also have to understand when it comes to cancer risk factors is that you don't get cancer all the time that you're exposed to the risk factor, and it's not everybody who's exposed to that risk factor who get cancer. That's why you see that in as much as alcohol, in as much as smoking, in as much as an unhealthy diet is linked to cancer, it's not everyone who drinks who will get cancer. It's not everyone who smokes who will get cancer. But we're saying that your chances of getting cancer are increased if you have those risk factors. If I may give an example, if somebody drinks alcohol and drives a car, what do you expect?
for them to
an
get into an
accident.
accident.
Yes. So that's what we are simply saying.
Yeah.
If you are at your risk of getting cancer is increased if you have any of the following risk factors that I have mentioned. Then other risk factors for cancers are infections such as viruses.
Right.
So usually the viruses that are linked with cancer of importance is the HPV virus, the
Right.
human papilloma virus, which is linked to the most common cancer that we have in Zimbabwe, which is cervical cancer. So some cancers are linked to certain viruses. And some of these cancers, we also have Kaposi sarcoma, we also have some lymphomas and other cancers that can be related to HIV.
I think that's quite interesting. I think, as you started when you were defining what cancer is, you said, first of all, people define it as a death sentence, right? Why do you think, or how informed is the public about cancer?
I think that's where the challenge is. There isn't much awareness going out there. If I may explain the background behind Talk Cancer Zim, I am a health professional. I'm a radiation therapist by profession. So my job is to wait for people to come to the hospital as cancer patients so that I can treat them. So during my practice over the years, I realized that people are coming late. People don't have in much information on cancer. So that's why we started Talk Cancer Zim, so that we are the health professionals. We have the right information. We have to go out there into the society and meet people before they become patients. People need to be informed. People need to know what cancer is, what are the risk factors, and that is not enough because some people are going to get cancer. They need to understand how cancer is treated. So at times people get a diagnosis, but they are scared to come to the hospital because they see cancer as a death sentence. So there isn't much awareness and education on cancer treatment, surgery, chemotherapy, radiotherapy. There's a lot of myths and misconceptions that the general public has, and there is need now for us to scale up awareness so that people are informed and make informed decisions concerning cancer treatment and even how they can live a healthier lifestyle to reduce their chances of getting cancer. And also, the importance of cancer screening should be emphasized because the earlier you get a diagnosis, the higher your chances of getting a cure. So usually people are showing up late. When you show up late, your chances of getting a cure are reduced. So at the end of the day, people now will have a misconception that cancer is a death sentence because people are coming on the deathbed for treatment. So people end up thinking that if you get cancer, you die. But the message that I want to emphasize is people should go and get screened. The earlier you get a diagnosis, the earlier you seek treatment, the higher your chances of surviving the disease.
Yeah. Well, after the short break, we'll continue this conversation. As Michelle said, the earlier you get treatment, the earlier the cancer can be detected. And of course, you can get the best treatment possible. After the short break, we'll continue this conversation as we look at the relationship between cancer and HIV. We'll be right back. Welcome back to the HIV Interventions Program, proudly brought to you by the National AIDS Council. Today on the HIV Interventions Program, we're talking about World Cancer Day, which is just around the corner, but also talking about the link between HIV and AIDS and cancer. And to join me for this conversation, I have Michelle Madzuzo, who is from Talk Cancer, and she's a radiation specialist who's taking us through what cancer really is. And she says cancer is actually not a death sentence, and people are very much misinformed about cancer. Thank you so much for joining us again, Michelle. So before the break, obviously we were creating a foundation on what cancer really is, and the types of cancer that people can get. But interestingly enough, this is obviously the HIV interventions program. So
Yes.
we have to talk about the relationship between cancer and HIV. Is there a relationship?
Yes, sure, definitely. Most of the patients that have cancer, most of them tend to be HIV positive.
Right.
So, what happens is when a person is HIV positive, their immune system is weakened.
Yeah.
So, when the immune system is weakened, it is not able to really fight off other diseases that can affect it. That's why you see someone with HIV can get cancer, can get TB. It's because of the weakened immune system.
Right.
So cancer can also take advantage of a weakened immune system. But now when it comes to cancer, it's not all the cancers that are linked to HIV. HIV is a virus, so a weakened immune system paves way for other viruses to thrive inside a cancer patient. That's why we realize that there are certain cancers that are very common in people with HIV because they are also linked to viruses. That's why you find cervical cancer is a common cancer to people with HIV because it is caused by the human papilloma virus. And this virus only not causes cervical cancer. It can also cause cancers such as anal cancers, rectal cancers, and there are also other viruses which cause cancers such as lymphomas. That's why you see some people with HIV can get lymphomas, and also some people with HIV can also get a cancer which is called Kaposi sarcoma because it is linked with a virus. So basically, there are three AIDS-defining cancers: cervical cancer, non-Hodgkin's lymphoma, and Kaposi sarcoma. But there are other cancers like anal cancers, rectal cancers, cancers of the throat that people with HIV can get. And now also because of ARVs, people with HIV are living longer. So at times they may end up getting cancers which are not really linked to HIV. But just because as you grow older, your chances of getting these certain types of cancers are enhanced. For example, you can end up having somebody getting breast cancer, prostate cancer, colon cancer. Not that it's linked to their HIV status, but it's because they have grown older, just like anybody else who's not HIV positive. So yes, there's definitely a link between HIV and cancer. And thanks to the advancement in HIV therapies, because now because of the ARVs, because of the immune system which will be stronger, the patients with HIV can now be treated using standard regimens that can be used for anybody, even those who do not have HIV. So now the outcome of their treatment is the same as those who do not have HIV. Their prognosis is actually better.
Okay.
Yes.
So obviously you've talked about the most common cancers of people with HIV, but let's look at some general common cancers in Zimbabwe, not necessarily linking it to HIV and AIDS. What are the most common cancers and the most deadliest cancers in Zimbabwe right now?
Oh, okay. According to the National Cancer Registry of Zimbabwe, the top 5 cancers that we have in the country. So we have cervical cancer, which affects women. We have breast cancer. We have prostate cancer, colon cancer, and Kaposi sarcoma as well. And the Ministry of Health and Child Care has set 4 cancers as priority cancers. These are cancers that we would want more awareness, screening to be raised on. So there is cervical cancer, breast cancer, prostate cancer, and colon cancer. Those are the cancers that we would want to focus mostly on as a country, but not saying that all the other cancers are not important. And also of importance, it has usually been left out, and some people actually think that children cannot get cancer, but children can get cancer too. So childhood cancers have also been categorized as priority cancers because there is need to raise awareness of childhood cancer, really.
Mm-hmm. Yeah, just going on childhood cancer, I
Mm.
know that obviously we have organizations such as Kids Can that are playing a key role with the support of National AIDS Council in making sure that parents are playing a key role in helping these children, especially get treatment.
Yes.
Um, when we're looking at children suffering from cancer, are these cases very common?
Well, childhood cancer is not very common because there are a lot of misconceptions surrounding childhood cancer.
Right.
So people may not really seek the conventional medicine.
Yes.
So at the end of the day, they will not really be captured by our system. So there are fewer children who are showing up at the institutions for cancer treatment. More children are now being absorbed in other alternative medicines. So at times, we do not know how many children are suffering from cancer out there. The statistics that we have are not really showing the true figures that we have in our country.
Yeah.
But childhood cancer is quite common in Zimbabwe. But it's just that people may not really show up to the treatment centers with the children.
Right. So,
Because people may think that it's a spiritual issue. Children
yes,
cannot
yes,
get
yes.
cancer.
You
Yes.
know, so that was my next question. Why do you think? And I think we've had experts coming on the HIV interventions program talking about why the last resort is the hospital or is the doctor or is the the treatment center when everyone has when I've exhausted all other, I've gone to the church, I've gone to spiritual healers, and
Yes.
why is the doctors the last resort? Why do you think we think like that instead of the other way around?
Okay. I've always asked people that when I can ask you, when you want to have your hair done, where do
Yeah,
you go?
to the saloon.
You go to the salon because you know that's where they make your hair look
Yeah,
nice. If you want a cake, where do you go?
to the bakery,
And when your car breaks down, where do you go?
to the mechanic.
And I always ask people, when you have cancer or when your relative has cancer, where do you go? You get a lot of answers. And it's usually, yes, like what you are saying, the last resort is the hospital.
Yeah.
The last resort is conventional medicine. But what I have noticed in the talks and the discussions that we've been having with people around the country, even with those who do the alternative
Yeah.
medicines, especially the traditional medicine medical practitioners, we've had some sessions with them. We found out that people are not informed. The issue of awareness that I was talking about. People fear chemotherapy, people fear radiotherapy because they think it kills them. When in actual fact, it seems that way because they are coming as a last resort when
Yes.
it's too late.
Yeah.
Then we also realize that this is a challenge that we now have as a nation. People are saying that there's too much out of the pocket cost for them when it comes to seeking conventional medicine. So at the end of the day, they would rather go to the alternative medicines because they are cheaper. And also the other challenge that they have, people say that the services are not easily accessible and at times they are not available.
Yeah.
So at the end of the day, they want to survive. They need options. They can always go back and look for those. So it is now up to us as a nation to make some reforms so that we really up our health system.
Yeah.
Because we would want people to know that when you have cancer, you should go to the hospital
Yes.
and get treated.
I definitely agree with you. So, it's I guess it's not all the community's fault, but they're also looking at some of the challenges we have in our
Yes.
health sector. Thanks so much, Michelle, for that. Lastly, Michelle, let's talk a little bit about what advice you would give people living with HIV and people living with cancer.
Okay. First of all, what I would say to people living with HIV, people living with cancer, your health really matters to us, to your family, and to the nation. So, whatever medicines that you've been prescribed, let us take those medicines as prescribed by our doctors. And let us eat healthy, eat a healthy diet which is balanced. Let us exercise. And what is important is you are a living testimony. Let us debunk the myths and misconceptions that people have surrounding HIV and cancer. Share your testimonies with people out there that you can survive cancer, that you can survive HIV. And also, it's important to also pass the message on to the communities that you live in, to your families. Tell them, encourage them to go for HIV testing, encourage them to go for cancer screening, because the earlier they get a diagnosis of HIV, the earlier they get a diagnosis of cancer, the higher their chances of getting treatment
Thank you so
and
much.
surviving.
Fantastic. The earlier you seek treatment, the higher the chances are of you surviving. Let's debunk these myths and let's use our first priority as the hospital instead of
Yes.
going elsewhere. But as Michelle said, if you want to get your hair done, you go to the salon and you know where to get all these things. But it seems when people get sick, we go elsewhere and our last resort is the hospital. Thank you so much to Michelle Mazuzo, who is from Talk Cancer. And of course, remember this program was proudly brought to you by the National AIDS Council, as of course we were debunking World Cancer Day, which is actually on the 4th of February, as of course we were encouraging prevention, detection, and treatment. We'll see you next time.